This is the Bartholomew Town Podcast.
All right, so clearly when we think about the thick of the pandemic here in Rhode Island and really just about everywhere, one of the things that jumps to the front of the conversation is the situation surrounding nursing homes and long-term care congregate facilities. I mean, what a travesty, right? What an absolute sad and specific event within the general pandemic. And there are a lot of lessons to learn from that, that we can use to move forward with and hopefully prevent, not only in the case of an extreme emergency like the thick of the COVID-19 pandemic, but just general best practices when it comes to long-term care here in Rhode Island. It's Bill Bartholomew here with you for another edition of Rhode Island's podcast of record, Bartholomew Town. Always a pleasure to have you on board. Today we have a panel discussion evaluating and assessing long-term care and exactly what we can learn from the COVID-19 pandemic and how we can move forward. And of course, we discussed the October 1st deadline that is now long since come and gone for healthcare workers to be vaccinated. That provokes a little bit of a lively discussion here on today's episode. You can support the podcast by subscribing, rating, and reviewing wherever you're listening right now, or by becoming an insider. Simply head to patreon.com/BartholomewTown, where for as little as $3 per month, you may help to sustain the independent journalism, entertainment, analysis, and opinion that we provide here in the Ocean State and beyond. Patreon.com/BartholomewTown.
My name is Kathleen Heren. I'm the Long-Term Care State Ombudsman for Rhode Island, and that means I advocate for people receiving long-term care services in long-term care facilities, which would also include home care hospice and the Eleanor Slater Hospital and the Veterans Home.
My name is Paul Jones. I'm the owner of the Care Concierge of New England, helping seniors and their families navigate all of the different care options in Rhode Island, Massachusetts, and Connecticut.
I'm Nicole Majik, and women leaders, business owners, and strategists hire me to find their fearlessly authentic self and align with their truth, passion, and purpose because they're sick of spinning their wheels and getting nowhere. So I help them create a personalized roadmap for successful growth while eliminating forever the sabotaging beliefs that derail them. Bottom line is I help them manifest the balanced life they deserve without compromising who they are or what they love.
Wow, that's quite the intro right there. Well done. I wish someone asked me what I did. I would have no idea what to say. I'd be rambling for like 45 seconds and they'd be gone. So well done. Look, during the course of the pandemic, it was exposed just how broken our long-term care system is here in Rhode Island. I think it was a conversation on a global scale. There's no question about it. There's gaping holes in the infrastructure, if you will, the personnel, the care that some people receive. How do we fix that? And I guess let's start with Kathleen, because that's sort of your key area. But how do we improve that generally speaking going forward? There's a lot of things that are probably not so obvious to make that change.
Well, I think that everybody will recognize that one of the populations that was hit the hardest during the pandemic was the elderly. There were many deaths. There were many people that without the vaccine were coming down with COVID themselves that worked in long-term care. But even before the COVID started, we still had staffing problems.
Yeah.
We had not enough people to fill the positions in long-term care, nursing assistants, RNs, and LPNs. And so that sometimes, in itself presents a problem. Now there's a new bill that's going to demand that there's a certain amount of percentage of staffing that's available in every nursing home. And they're, going to make sure they even bring it down to how many hours each resident will receive with care. I don't know where they're going to find people. I know the health department has gone back to thinking that they might grant these temporary licenses for nursing assistants where they supposedly take 15 hours of training. And then what they do is they go out and they supposedly get clinical from the long-term care facilities. This is good, but, with the Family Cares Act, I'd rather see the families coming in and taking care of their loved ones than bringing people in that may not be qualified. I don't like this, hit and run. Years and years ago, when I started in the profession of long-term care, we did that. One bad aide trained another bad aide, trained another bad aide. And that's how I got involved with the CETA training program, which was with the Department of Labor. I ran all the nursing assistant programs through CETA. And that was when you had to have a certificate or be grandfathered in. So I know that there's a need to get help in, but I'm not sure that's the way to do it. I'd rather see the family members come in, because it's been my experience that no one takes care of a family member like a family member.
Yeah,
it's also, it's quite evident that there was not an awful lot of infection control and knowledge of what to do through a pandemic. That I know. I used to be an infection control nurse in long-term care, so I could kind of relate to, what was going on and as far as what people were doing. I will say that the nurses nowadays that are coming out of training, and I also sit on the Rhode Island Nursing Board, are not as equipped to be able to toughen up and do things the way we were. They panic and throw their hands up, but they don't really come up with a lot of innovative ideas of how they're going to get around something. If the health department doesn't think it up for them, they're asking somebody else to do it. And, I'm sure that, some of them won't like what I said, but it's the truth. You just don't get that type of commitment and that type of ability to think on your feet. I was trained at St. Joseph's Hospital. If you didn't think on your feet, the nun would step on both of them for you. So it was kind of like, you better do something, and you better survive this particular problem you're having. So that's something. I think the saddest thing that I went through was watching families that could not go in and be with their loved ones anymore on visits. There were those who got pretty creative with that whole thing. I had one person who took a sheet, the resident took a sheet and knotted it all up and sent it down to her son, who was standing below the window. The only problem with that was they couldn't get her back in. There's been a lot of different things, and I feel bad for the residents. I really do, and I felt even worse for the families. Thank goodness Dr. Nicole Smith allowed us to do those compassionate visits. So that if somebody's mother or father or husband or wife was at the end of life, they were able to go in naturally with protective equipment, but at least they were able to spend that last, amount of time with them, which a lot of people didn't. The nursing homes were very good with Zoom calls so that my office could stay involved. I've worked every day of the pandemic since it started. I lost all my vacation last year, all everything else. I'm not saying that to feel sorry for it. I just feel there's still a big obligation right now to be able to reach out and talk to people when they're in a crisis. And usually crises happen on weekends and holidays. So I try to make myself available to the residents, to the nursing homes, and also to the families so that I can help them out with a problem that may occur.
Yeah, and what you're speaking to there really is one of the great tragedies of our time, and that is the lack of interaction between family members and folks in long-term care. And there's so many stories of people who, have these just really dark and sad situations where someone passed away without having that visitation. There was a caller to the radio station that I work with that, he would call constantly saying, I got to get in to see my wife. She's at the end of her life. And, it was just this heartbreaking story that was frankly extremely depressing. Paul, from your vantage point, as we look to the future, as we look to move forward, how do people, I guess, take back the control of, this really vulnerable portion of their life, so to speak? If you're somebody who is, pandemic aside, how do people have be more empowered in this moment of end of life and interacting with their families?
Yeah, with families across the state, this was something that I ran into, and Kathy hit on so many good points about how isolation made things so much worse for families as they were trying to manage through the natural pandemic stresses, and then it added on to not being able to visit their loved ones, see their loved ones, staffing issues at different facilities and communities. But in terms of taking the power back when it comes to aging in place, be it in your home or in a community setting, I think it's really important for folks just to remember that as technology improves, we are trying to develop better ways to keep connected with our loved ones. And for the pandemic, now I work a lot in the assisted living space. For the pandemic, your average activity staff didn't take a lot of advantage of all of the different technological devices and programs that were out there to allow people to, say, FaceTime with family out of state. One of the small silver linings of what's happened over the last year and a half is that inside these assisted living communities, inside the teams of home care agencies, inside even skilled nursing facilities, more and more teams are focused on life enrichment for the residents who are living either in their home or in community settings. And a lot of that has to do with activities and programs and recalibrating dining service and helping people connect with things that maybe they hadn't done for the past couple of years because they were getting older and maybe felt as though they couldn't. And now as they're aging in place, they're feeling, no, I can do these things again. You know, maybe I never lost them. Maybe I just lost the urge to do them, but I've always had the power to do them. And then, you know, going back to what Kathy said too, I just wanted to circle back. She hit on so many good things and so many right things. One of the most important things that families should consider when trying to figure out what is the next step in their aging journey is going to be, what type of staffing model are you looking for? Are you looking for more one-on-one care? Are you looking for more of a community care, less oversight, more independence? What is it you're searching for? I think that what we're seeing over the past couple of months and past couple of weeks in particular, we're seeing a lot of healthcare workers step aside because they're choosing not to get the vaccine. I think we're going to see a lot of new people coming in to take those positions who are going to feel empowered by the calling of personal care, resident care, life enrichment. And we're going to see a much more positive change, I think, in the long-term care space moving forward. A lot of that's going to have to do with new staffing and new training.
It's been really fascinating as a human experience, if you will, to watch the situation play out with healthcare facility staff that refuse to be vaccinated. It's one of those things where, you know, I personally try to have an open mind on any issue. You know what I mean? Even if I fundamentally disagree with somebody on a position, but I can't wrap my head around this one. You know, as far as why somebody who works especially with vulnerable populations would refuse to get the vaccine. I think there's a lot of it that's just superstition, fear. It's tied into Trumpism and QAnon and these types of things. It's not a very sophisticated position to have. How do we get past this? And I guess I would ask you, Nicole, as well, in this climate that we're in right now, how would you encourage people to sort of proceed so that they have their best interest when it's clear that there are people who don't have their best interest or their family's best interest when it comes to healthcare? Now, having said that, the vast majority of healthcare workers are vaccinated, didn't lose their job on October 1st. It's not as if this is like a rampant problem, but in an environment that you could have 1,000, 2,000, 3,000, whatever it is, healthcare workers that refuse to be vaccinated, how do you take control of your own destiny, so to speak?
I think that's a great question. And I think that, you know, with my background in biology, chemistry, as well as finance and experience in long-term care, we really need to take a look at the beliefs that we have, right? And when we take a look at the beliefs, everybody acts in accordance with their beliefs, whether they're subconscious or chosen beliefs. And if you look at any given side of that, which side is right and which side is wrong? Is there a right and is there a wrong? I don't believe that there is. It all depends on what your beliefs are, what you choose. And if we look at how do we, instead of dividing, how do we then say, how do we include everybody and still be safe and caring for the patient as well as the person providing the care? Because it's neither one nor the other, it's both, right? So when we look at what these situations are, what are the options? Because we can take precautions for people. There are also elderly who refuse to get vaxxed, right? And
right, sure.
So the beliefs go across the boards from young to elderly, and we need to just take what is the right steps to taking the precautions, providing the care that everybody deserves, and also providing the workplace atmosphere that everybody deserves to be in there. So what does that actually mean? There has to be some way that people can come together and provide, whether it's, they've had wings in hospitals that were just COVID. So what if we took a look at the options of providing care that it goes along with a particular belief, or healthcare workers that may not be vaxxed versus healthcare workers that are vaxxed, and providing the level of care that continues to provide for both worker and patient.
But isn't it sort of like saying, well, why don't we just have pilots that are allowed to fly drunk, and you can sign up for that as well? If you're, we'll have some planes that patients that or airline travelers that say, hey, you know what, I'm okay with that. I don't care. We'll have the drinking pilots. Isn't it one of those situations where personal beliefs are trumped by the greater good? No pun intended.
If it's a matter of personal beliefs, are you saying that somebody has a personal belief that I have the right to fly drunk? So if we look at the pilots, if they're getting drunk and flying drunk, what does that actually mean? That's endangerment versus a personal belief that, that could be a spiritual belief, a religious belief, just a moral belief. So how do we say which one is right or wrong? When we're drinking and driving, or drinking and flying and endangering a life on purpose, that is
one of the things I've seen happen, which is unfortunate, is there's always gray matter. You just get one rule down, and then everybody starts running around. Well, maybe if your left head is bigger on one side than the other, then you can do this. If you choose to work in healthcare, you know what you're supposed to do. I know I'm an old-time nurse. But if, it's just, I think I sent something to somebody yesterday that said, if I'm a Jehovah's Witness, I can't work in a blood bank. So if you're going to work in healthcare and you want to have a religious objection, that's fine. That's your right to do that. But don't impose that upon people who have had a high amount of death. You can't do anything with a resident that won't be vaccinated except take precautions for yourself, and also that you don't spread it from somebody else. But I can tell you, very few people have refused vaccination in the elderly.
This episode is brought to you by Elmwood Songwriters Club, presented by B-Town. It's a monthly showcase featuring 7 artists from all around the region. With the order drawn at random, each artist performs 2 songs. You can find details about when the next event is here in Providence by following me on Twitter and Instagram at Bill Bartholomew.
Well, another end of it, too, is that in a lot of... So I've been working in the assisted living space for a little over 10 years now. And my particular specialty was in memory care, memory support, Alzheimer's disease. And even within certain Alzheimer's care neighborhoods or facilities, I would come across staff when I was trying to train staff or interviewing staff who would think that the symptoms of Alzheimer's disease were being faked by the residents. That was their belief. But we're working there with these folks. We'd have to figure out it shouldn't work if that's the way that they were thinking. My point here is that personal beliefs can extend as far as the next person. And I think that in terms of what's going on with the COVID vaccinations in particular, and Nicole, I have heard that argument before. Well, why don't we just have these folks be served on this part of the campus by these particular people? But where does that end? COVID-19 is not the only vaccine that is required by healthcare workers. Where does that end? And then where does it end if I have that person who is working on the Alzheimer's floor who says, I don't really believe in this Alzheimer's thing. I think they're faking it. I know that's impacting that personal care. It's that worker's personal belief. It's impacting the care for somebody else. At that point, I have to step in and say, whoa, wait a second. I can see that you have your personal belief, and I respect you having that personal belief. But if your personal belief is going to cause even implied harm to somebody else, you got to take that elsewhere. And I think a lot of these folks who work in healthcare, they're doing that. I don't know where they're going to go work with their skills now. I have no idea. I know that over the last couple of weeks, a lot of the folks who were resisting vaccination said, all right, fine, this is a serious thing. We're actually going to lose our jobs. We need to get vaccinated. And so, although nobody's minimizing the amount of people who have left their positions, I think the impact has been much less than was originally feared. And that some people, especially certain of our state politicians, are capitalize on and make this a big fearsome thing and your families won't be taken care of. That's not true. It's not true. The vast majority of the people who work in healthcare, the vast majority of people who work in long-term care, they value life and they care so much about the people that they serve. So, I mean, Kathy, you're a nurse, you take that oath and it becomes part of your life, right?
Yes, absolutely. And I don't know if, I'm sure you all have seen Dr. Scully, the dentist.
Sure.
I know Dr. Scully. He's one of the kindest people. When I have Medicaid patients that nobody else will take care of, he takes them in and does them for free. I don't know why he's gotten mixed up with all of this ridiculousness, but him taking that particular stand is going to hurt a lot of people. I almost wanted to email him, but I said, we're friends. Let me just shut my mouth right now and not say what I really think. But that's a shame that anybody could be driven to that point where they have to make a stand publicly. And I don't think he ever thought he'd lose his license over it. But people are just tired of all of this. They're tired of people making this into a political circus, which is what they're doing.
And you know what? Long-term care and getting older in America has a lot of fear revolving around it anyway, right?
Yeah.
I mean, I deal with misperceptions every day from families who call me and they go, okay, my loved one, they need long-term care. Are we going to be able to visit? What kind of things happen there? I mean, what's going on? And then I have to explain to people, first of all, the difference between assisted living and nursing, living being of a more social model community setting and skilled nursing being a medical model facility setting, both with their places for people in care services, but also how, again, people who work in this industry, they put their blood, sweat, and tears in making sure the quality of life of people who are going through this system are as high as possible. Detriment sometimes of their own sleep, of their own sanity. Sometimes, it's amazing to see what workers will do to care for people in this state. But you wouldn't know it sometimes hearing the fear that comes out of some folks.
Yeah, that's for sure as well. That this has become theatrics for certain outlets. It can be used to sell mattresses and used cars, tune in so we can tell you about how, your grandmother's not going to have health care that's adequate, in 2 days because this deadline's looming. But last couple of minutes, and Nicole, we'll start with you. When you look at the current landscape right now of long-term care, elderly care, just generally speaking, what's your gut instinct? Are we heading in the right direction?
I don't know. I want to go back to something that Kathleen had said where, nobody cares for a family member like a family member. And I think that really taking a hard look at the restrictions and how do we allow family members to come on in, because I've seen a lot of restrictions being put on limiting the amount of people that can come in. And yet when family members are trying to pull together to take shifts on certain things, that is what is becoming really difficult and heartbreaking, because this is hitting home with me, and it really is a difficult time for a lot of people. And we really need to pull together to find what works for the families and the individuals, because there are some people that don't have anyone. And then there are some people that have many children and many family members that are willing to pull together to help, but they can't just have one person to do it all.
Absolutely. Paul, your thoughts on the outlook here going forward?
I think in general, although things can feel kind of bleak right now, I don't think that's the actual look what the long-term care space really is. I think a lot of lessons have been learned throughout the COVID. It's still ongoing, but through these first stages of the COVID pandemic, a lot of lessons were learned, and things were put into place to help prevent exactly what Nicole was just talking about. We want, as an industry, we don't want to go back to a position where families find it so difficult to come and visit their loved ones and be with their family members and be part of their lives. That's not what this is all about. It's supposed to be about empowering families to be family again and not a collection of caregivers trying to piece things together. And I think that as we continue to learn these lessons and create better environments for people to age in place and create this quality of life, we're going to see aging in America become better and less frightening than it is right now. The most critical piece of it is going to be the training of staff, the training and retention of staff who are skilled, who understand the metrics and the needs of people who are aging. And frankly, not to get in the soapbox, but to pay people better. We need to pay our certified nursing assistants better. We need to make sure that we're empowering the people who care for our loved ones to live well and only have to work one job. Too many CNAs are working 2 or 3 jobs. How can you get good quality of care if that is what you're telling your CNAs they have to do? And nurses. So,
yeah, no, I completely agree on the compensation. There's no question about it. When you see some of those numbers, you go, whoa, wait a second now. This is nuts. There's people who are, at lemonade stands making more. I mean, it's almost embarrassing. All right, let's close it out. Kathleen, your take on the outlook for long-term care and elderly care here in the state and beyond.
2 points I want to make, and I'd be remiss if I didn't make one. There are a lot of success stories out there with the long-term care community. I deal with the nursing homes mostly. We have an ombudsman in here that deals mostly with the assisted living, but there have been some extraordinary things that have been done by some of the administrators to better the residents' life, to try to make it so that, they don't do it black and white. They can bend a little bit. So that's one thing. And I want you to know, because I'm in contact with all my colleagues across the United States, Rhode Island is a pretty good state for long-term care. Yep. as opposed to other states. I mean, horror stories that I hear are the stupid things that go on in other states. I mean, down in Louisiana, taking everybody out of a nursing home and sticking them in a factory. So
unreal.
Right.
Yep.
These are the types of things that you don't see happen in Rhode Island. Are we perfect? No. But we do have a good long-term care system. And at least like in Paul's instance with the assisted livings, there are rules and regulations. Some states, assisted livings are not regulated. So they just have, a field day doing anything they want. So I want to say that. But I think, you see your darkest days before you see the sun. And I think as soon as we can get a little bit more herd immunity, and I think with the booster shots that are coming out, we stand a chance. If people don't want to be vaccinated, that's fine. Then go do something else with your life. Leave the elderly alone and leave the disabled alone, because they're the ones that are suffering from people that don't want to do anything.
Kathleen, Paul, Nicole, lively conversation. Great stuff. Appreciate all of you very much and your advocacy and the work that you do. It's critical to our state. And, you're the people who get ideas and conversation moving and make things happen. You're amongst that group of thousands of Rhode Islanders that people don't oftentimes look to. They look to, what's the governor have to say, or Dr. Alexander Scott? But the reality is, specifically in COVID and in general, it's the ideas and the action that happens below the surface. That's where the movers and shakers are. So thank you all.
Thank you.
Thank you.
Thank you.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits. and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.